here, it is resting here. You see that? So it's not actually in between. It's not in the joint exactly. So this position actually is called CR, and that's because that's the thickest part of the dense fibrous connective tissue, and so it is less likely to resolve. Okay, so everything is nicely designed here, and everything goes together. Okay, anatomy and function. Okay, they all go together. The fibrous tissue is situated to the demands. Okay, it is so you see that the dense fibrous tissue. Okay, the dense fibrous tissue is suited to the demands of movement and more regenerative capacity than cartilage. Okay, so the fibrous tissue has some regenerative capacity when you compare it to cartilage. All right. So in a joint which is always moving, when moving, it's either moving when you're eating, moving when you're talking, okay, yawning or whatever you're doing, but that joint is always functioning. So to prevent it from wear, there's always the fibrous tissue has a regenerative capacity. All right. But however, when you compare to cartilage, cartilage doesn't regrow easily. If you want to regenerate the cartilage, it's very difficult. So the TMJ is also unique when compared to other joints of the body because the movement of the joint is affected by an outside structure, which is teeth. Okay, as we mentioned in the last lecture, we saw that the the stiffness of the articular eminence, if it's too stiff, the cusp tips of the teeth are going to be long. Okay, if the cusp tips of the teeth are long, the prominence of the articular eminence of the TMJ has to be also steep. All right, and if the articular eminence slope is very shallow, okay, then you're going to have flat cusps of teeth. Okay, so occlusion does affect TMJ. That's why malocclusion can cause internal TMJ derangement. So the adult conda is approximately 15 to 20 millimeters long. Okay, and mediolaterally, so this direction here, mediolateral, is 15 to 20 millimeters. And anterior posteriorly, it is 8 to 10 meters wide. So it is the TMJ is like a what do I say? It's like a football, not soccer ball. The soccer ball is round, but football, American football. Okay, so it's like that. It's like an egg, almost. All right. So the medial pole. So you have the medial pole. This is lateral. This is medial, and you would say, okay, how? So this is, I'll say medial. So you would say, how do you know this is lateral? This is medial. Okay. So you can see, if you know the anatomy of TMJ, you can see that this is the lingular, right? This is the lingular. This is where the sphenomandibular ligament attaches. All right. And so this is on the medial side. All right, that's how you identify. So you have to know your anatomy. So the medial paw is more prominent, meaning it's pointed. As you can see, this is the lateral paw. The medial paw is almost like pointed like that. Okay, compared to the lateral paw. And when viewed from the side, The conda is quite convex. So make sure you remember that. Okay. The conda is quite convex when you're viewing it from the side. Okay. Anterior posteriorly. Anterior posteriorly. So anterior posterior. The conda, you have a convex conda. Okay. Make sure you remember that. Okay. All right. And when you're viewing from the front, the conda is slightly convex. So all in all, when you look in all directions, the conda is convex. So it's like a football. Okay, everything is nicely rounded. All right, convex surfaces. Okay, anterior, posterior, medial, laterally, the conda is convex. Now, what's the opposite of convex? If you put two objects which are convex together, if you, for example, you put two footballs together like this, there's no stability here. Okay, it's not going to be stable. You can't move. So you need something opposite to convex. What's opposite to convex is concave. So if okay, if the conda is convex, the glenoid fossa has to be concave. Now, to make it interesting, also the 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 when you put the conda, okay, the normal anatomy of the conda and the glenoid fossa without the disc, it is incongruent. Okay. It is incongruent. So there's no congruency. They are not equal in shape. They don't fit properly. All right. That's why it's not a ball and socket. All right. Because the conda without the disc, the conda itself does not fit in the glenoid fossa. Make sure you remember that. When you take out the disc, the conda does not fit, okay, in the glenoid fossa. And usually the pictures that are shown on the skeleton or some of the skeletal models, it shows that, oh, the conda is fitting in the glenoid fossa. That's not true. The glenoid fossa is kind of ragged, okay? And so when you look at the disc is a three-dimensional. It is not actually, it is not, it helps to distribute the forces along the glenoid fossa because the glenoid fossa, it does not fit to the conda, all right? So the articular disc has to be biconcave, all right? So articular disc is biconcave disc. The conda is convex. The articular disc is sorry, the conda is convex and the articular disc is concave. All right. So if it I had a student who asked me what is convex, what is concave, right? So it depends on where you're looking, but it's essentially if you're looking from outside, for example, you're looking from here, okay? If you are here and you're looking up, so something which is concave is going to be like this. Okay, and something which is concave, I mean, this is concave. This is concave. Convex is going to be something opposite. It's going to be like something like this. Okay. So this area is convex. All right. So you have to understand that. Okay. So the articular surface of the conda is on the superior anterior border of the condylar head. That is where the anterior superior, so this one, AS, that's anterior superior. Anterior superior is where the articular surface of the conda is. This is correlates to the position of centric relation. Centric relation is when the conda is in the most superior anterior on the posterior surface of the articular eminence. I'll keep saying that so that you know the definition of CR. The articular surfaces, okay? The articular surface face forward and upward to approximate the posterior slope of the articular eminence. Okay? All right.